So I want to pick up on what you were talking about, Joe, which is about building trust and building trust with intention. And also, if Representative Wale is still there, we can bring him back up.
I'm here.
Great, terrific. You started to talk about the extensive outreach that was done by Baker Ripley and other partners. And so I want to ask sort of a two-part question. The first is, the thing about case studies is we usually talk about them when the thing is successful and the coalition is built. And so I would love for each of you to talk about what it was like to actually start building that trust. What did you do to really engage residents deeply and really get to resident leadership and that co-creation? That's part one. And part two is I want to pick up on something else you alluded to, Representative, which was flooding. So I live in Miami Beach, and like Houston, we sometimes have major weather events that are increasing in frequency and in both seriousness. And I would love to hear from each of you, actually, how does that inform your thinking about the necessity for inclusive placemaking and how you engage when you're actually in crisis mode?
Well, on your first question on how folks engage, well, Baker Ripley, we already had a lot of strong leadership in the community. We had a lot of community leaders. So the entity, which is the Aldine Management District that assesses as one penny sales tax, they have a board, and a lot of those board members live in the community. And so we had a lot of natural leadership there. In the school district's very involved. It's a very tight-knit community. So we all know each other. We all know where folks live. And so when Baker Ripley came out and started to do their assessments, they brought their staff. They brought folks that have worked in our community in the past, like Jose Rivera and a whole bunch of other staff members that started to, literally block walk, knock on doors, talk to, go to churches that are predominantly African-American churches, Greater Pure Light on Aldine Mail Route, St. Leo, which is a predominantly Hispanic church, North Houston Baptist, which is primarily Anglo. And so they were, hitting a lot of these faith-based communities and trying to get a feel what folks wanted to do, what did they want to see, and pretty much be on a listening tour instead of being told what they as an institution can do for them in a very a very elitist manner. They didn't do that, and so they actually came in. They had multiple. I mean, I would say dozens and dozens of planning meetings, of meeting with our youth, meeting with senior citizens. We have a senior citizen facility down the street called Pilgrim Place, and so they did a wonderful job in going on a listening tour and actually hearing and not just speaking. They were actually having a conversation of what folks wanted, what they wanted to see in the community, and what actually Baker Ripley could do to bring some of those services. So when you're talking about health, Baker Ripley doesn't have a clinic, but they have great partnerships. They're institutional partnerships that come in and bring that expertise. And so, Baker Ripley built out the clinic and partnered with Hope to bring that clinic in there. And so I think to your first question, they did a great job and actually knocking on doors, doing an actual grassroots campaign. I've been involved in political campaigns my whole life. You really got to meet people at their door. And that's what they did in this area. To touch upon your second issue on the flooding, we've had our fair share of hurricanes and tropical storms. The first storm that I actually worked on as a government employee, I was working for a member of Congress named Gene Green. We had Tropical Storm Allison hit our community, flooded thousands of homes in our community. Then we had Rita, then we had Ike, and then obviously we had the trifecta of the Memorial Day floods, Tax Day floods, and then recently we had obviously the national, international news of Harvey dropping 60 inches of rain in our region, and then Imelda, which was a couple of months back. And so there is a lot of concern for flooding and being able to respond to that issue. And so at Baker Ripley, we actually had a community meeting there where we brought all the agencies, the Harris County Flood Control District, which is a governmental entity, the General Land Office that actually accepts the state grants, Texas Office of Emergency Management, a lot of our county and city agencies. We brought them all together, and I think we had 200 or 300 people that showed up at Baker Ripley at one of the forums that we had there, and it was very animated. Folks were angry. They want to see what their government is doing to respond to a lot of these drainage issues. You mentioned sidewalks. There's parts of this area that it took 20, 30 years to get sidewalks just along this community corridor. We have a lot of issues. We have a lot of momentum going, but we certainly appreciate being able to be at Baker Ripley and issue our or express our views to those agencies that need to address our issue. And then those of you that have been involved in government, the squeaky wheel gets the grease. And so building that institutional knowledge, building those community leaders with the youth program that they have community engineers that are learning about how to address an elected official, how to talk to sign up for city council public session, county commissioner's court public session, how to go to Austin, Texas and testify during the committee process when bills are being debated. That's all a lot of the work that's being done in a collaborative way with a lot of the NALEO, which is a National Association of Latino Elected Officials, working with them on the census. And so I'll stop there and if y'all have any other questions, but there's a lot of momentum going on right now, but we need a lot of help. But we thank all the foundation, Episcopal, Houston Endowment, all the foundations that have donated to this project, because government, unfortunately, at this point, wasn't responding to the needs of our community. And so, but for collaboration with the nonprofit agencies and the endowments, we wouldn't have this center. We wouldn't have a place to call our own, and we wouldn't have a place to get folks that we can hold accountable in these appointed positions. It's something that we're proud of, and we're going to continue to fight for a lot of these issues, and particularly healthcare disparities. That's a huge issue. My grandmother passed due to complications to diabetes, and so having these hike and bike trails in this community where folks that have health issues can walk, and just that 30 minutes a day can help them in just that anecdotal way. But I know there are thousands of people in my community that suffer from diabetes, and so that are on dialysis, and it's a terrible, terrible disease. And I'll end with this. We have the largest medical center in the world, very prosperous, but I think it's a travesty that 2 miles down the street, you have abject poverty, where you don't have folks that can get basic primary care in this city and in this state. I mean, we have one of the highest rates of uninsured, probably 25%, I think, in the country. And so it's something that we care about a lot. Healthcare is a big component of that. So, we're just proud to be able to, have this opportunity to express ourselves, utilizing partners like Baker Ripley and others.
Thanks. So, Joe, we're just about out of time, but I want to give you a chance to respond.
So I would add a couple of things to that. I think what natural disasters do, and what they certainly did in Houston, given the number of disasters that he just mentioned, all of that happened within the last 3 years. Major disasters, one after the other. And so what happened is that it really, it flattened, it flattened the structure in that communities, people, stakeholders, institutions started working together in ways that cut across race, structural considerations around governance, that kind of thing. Those still exist in the community, so that when the next disaster comes around, we're so much better. And there's more trust within the community writ large as a result of that. The other thing that I would add is that we are not an operating foundation, so we don't do programs. What we do, however, is look in communities to see who is working with whom, and how long has that work been going on. So is there an existing coalition? Is there some structure that we can come alongside as a philanthropy and support and begin to build those kinds of skills, use our resources with funding and research and other things that we bring to the table in tandem with others who share a same goal around solving a problem of community health?
So please join me in thanking Joe and Representative Wale.
Thank you.